This is my video on how to take a blood pressure measurement. When a client first walks into the room, I'd introduce myself saying, "Hi, my name is Madison Corin. I'm a third-year kinesiology student," and I ask them to please take a seat. Once they were seated, I'd ask them about their basic information, such as their name, age, and sex. I'd also ask them how they're doing that day, how they're feeling. I'd ask them if they'd drank any alcohol or done any strenuous exercise in the last 6 hours. I'd also ask if they'd smoked, eaten, or had any caffeine in the last 2 hours. If they were female, I'd ask if there was any chance that they could be pregnant. Next, I'd ask if they'd filled out their Get Active questionnaire and their informed consent form. If they'd said a yes to any of the questions on the Get Active questionnaire, I'd ask them if they had clearance from their physician to participate in physical activity. I'd explain to them that I'm taking their blood pressure measurement and answer any questions that they had. Next, I'd have the client sit quietly in a chair for 5 minutes with good posture, back flat against the chair, feet flat on the floor, and arms on the armrest next to them. After that 5 minutes, I'd try to find their radial pulse. So taking their wrist, I'd take 2 fingers, just proximal to the wrist on the lateral side of the wrist. Taking 2 fingers, probably index and middle. You could also take your middle finger in your ring, just don't use your thumb. Taking the 2 fingers, pressing a little bit, not enough that it cuts off circulation, but just enough that you can feel the pulse. And right there I can feel my pulse. So next I'd check that my stethoscope is ready. I'd want to make sure that's on. So if it's a 2-sided stethoscope, on the smaller side, there's a little hole, and if it's on, there's a little ball that's sitting in the hole. If it's not on, then you can just turn the bell, and once that ball clicks into place, you know that the stethoscope is on. The earpieces, you want them facing forward, going into your ears. If it's a one-sided stethoscope, then you don't have to worry about it being on or not. It's always on. With the blood pressure cuff, there's usually 2 sizes, so depending on the size of the person, larger or smaller. Ideally you want to take the blood pressure measurement with the cuff on just skin. So if they have a t-shirt, ask them to roll it up on their shoulder. If it's a really thin long sleeve that they can't pull up, if it's thin, then it's fine. You can do it over top, but you don't want them to have a thick hoodie on. Anything thick, you don't want them to be wearing during the blood pressure measurement. With the cuff itself, there's usually a little mark saying brachial artery. You want to place that the cuff itself, you want it about 2.5 centimeters above the crease of the elbow, but that mark you want on the brachial artery, so on the inside of the bicep. If there's no mark, then where the 2 tubes come out of the cuff, that's where you want to place it along that brachial artery. You want the cuff tight enough that it doesn't slip down during the measurement, but not tight enough that it cuts off circulation. Out of the 2 tubes, there's the blood pressure monitor and the pump. With the blood pressure monitor, you can either clip on to the top of the cuff or have the patient hold it for you. With the pump, you want the little valve on it to be tight enough to the right that it's not letting any air out while you're trying to pump it up, but also loose enough that you can release it when the time comes. Next, so now you're ready with the blood pressure cuff on. You want to find the radial pulse and with your fingers, and now you're going to pump up with the closed valve, pump up to about 70 millimeters of mercury. You'll read that on the monitor. Then after that, you're going to, still feeling the radial pulse, pump up in increments of 10 millimeters of mercury and until you can no longer feel the pulse. Then after that point, you're going to pump it up another 20 to 30 millimeters of mercury. Now, you're going to place your stethoscope with the bell between 2 fingers. You don't want a finger on the small side of the bell, just on either side, onto the brachial artery, around where that mark was with the blood pressure cuff. And now you're going to slowly release pressure out of the cuff through the little valve on the pump. And you're going to release at about a rate of 2 millimeters of mercury per second until you can hear the first sound through the stethoscope. That first sound through the stethoscope is going to be your systolic blood pressure. With this one, let's say it's about 114 millimeters of mercury, okay? And now we're going to continue releasing at that rate of 2 millimeters of mercury per second until we can no longer hear any sounds in our stethoscope. That point is going to be our diastolic blood pressure, and let's say it's about 78 millimeters of mercury, okay? Then after that, we can release all the pressure from the blood pressure cuff. So our blood pressure measurement for this test would be 114 millimeters of mercury over 78 millimeters of mercury. The top number, the 114 millimeters, is our systolic blood pressure, which pretty much means is the amount of pressure on the blood vessel from the blood during the contraction of the ventricles of the heart. It's simple enough that it's just the pulse. Your pulse, or what you take for your heart rate, that's our systolic blood pressure, what you can feel. Diastolic blood pressure, that's the bottom number, so 78 millimeters of mercury in this case. That is the pressure on the vessels when our heart is relaxed. So normally, systolic blood pressure is about 110 to 140 millimeters of mercury, and our diastolic blood pressure, the bottom one, smaller one usually, hopefully, is about 60 to 90 millimeters of mercury. So our reading of 114 millimeters over 78 millimeters of mercury is right in that range. So yeah, that's it. Thank you.